people by their counsel as before. Dr. Shafer, once again, is present on the witness stand. All jurors and the 5 alternates have joined us. To everyone, good afternoon. Thank you. Good afternoon, jurors. Good afternoon, Dr. Shafer, sir. You acknowledge you're still under oath and still sworn to tell the truth?
Yes, Your Honor.
Thank you. This will be a resumption of direct examination by the people. Mr. Walgren.
Thank you, Your Honor.
Thank you.
Dr. Shafer, we had left off, you had talked about 2 separate individual egregious violations. You had mentioned the failure to continuously observe the mental status as well as the failure to continuously observe the breathing of Michael Jackson.
Correct.
You then in your report additionally note the failure to continuously monitor the patient by use of blood pressure monitors, heart rate, and pulse oximetry. Now, is that correct?
That is correct.
And this continuous monitoring, is that additional to the need to have these monitors? There's also the additional requirement to continuously utilize these monitors and monitor the patient.
That is correct. Individually, each of those represents an egregious violation. The distinction is, it's one thing to place the monitor on and have it available. Not having the monitor is a problem. But if you place the monitor on the patient and you don't use it, you might as well not have it. So the failure to continuously monitor mental status, breathing, just by watching the chest rise and fall, oxygen saturation in the blood, the electrocardiogram, and the blood pressure, each one of those should have been monitored continuously during the administration of propofol, but they were not. And each of those individually is an egregious violation that could have led to the death of Michael Jackson.
And in this particular case, in your opinion, did that failure on each of those individually directly contribute to the death of Michael Jackson?
Yes.
Now, again, you talked about the need to document and keep records. You additionally note in your report the need to continuously document and keep the records during the course of sedation, noting such things of vital signs, trends in the patient's condition, and things of that nature. Can you elaborate on that, please?
Yes. As you make the observation, you write it down. Among other things, it forces you to make the observation. It forces you to actually look and say, 5 minutes are up. Let me write down the blood pressure. Let me write down how fast the person is breathing. Let me write down the heart rate. Making the observation and writing it down every 5 minutes forces you to do it and to document it. It's part of the act of giving care. If he had been doing that, he would have seen within a few moments when Michael Jackson stopped breathing, the oxygen saturation started to drop, and eventually the electrocardiogram changed as Michael Jackson's heart was dying. And those would have been seen if he had been continuously observing them and writing them down, because it's the writing down that forces you to have this record. So it's the continuous documentation is also an egregious violation. The lack of continuous documentation.
And this documentation, this need for it to be continuous, does this, as you had indicated earlier, this affects not only, or is not only an egregious violation, but you indicated it was unconscionable in that it violated not only the patient's rights, but Michael Jackson's family's rights. Does that apply equally here?
Yes. The family has the right to know what happened throughout the administration of propofol. That right has been denied to them.
And is that, again, why that being a fundamental right for both the patient and the patient's family, is that why you found it to be both egregious and fundamentally unethical and unconscionable?
Yes, it violated the rights of both Michael Jackson and the Jackson family.
Dr. Shafer, I want to talk, as you did in your report, a little bit about the resuscitative efforts of Conrad Murray. And I want to begin initially with the failure to timely call 911. You found that to be independently an egregious violation, is that correct?
Absolutely.
And can you describe a doctor's obligation in that situation when they find an unresponsive patient?
In that setting, it's almost impossible that Michael Jackson could have been revived given the status of his heart without assistance. You have to get advanced support there instantly. Instant leave is within a few minutes. You have to call immediately. It's the most important thing that has to be done at the moment the disaster is realized. There is nothing that is a higher priority than calling for help at the moment of the disaster.
And in this setting, with Dr. Murray there knowing full well that he does not have the equipment or the personnel necessary, calling for help, by that do you mean calling 911?
Calling 911.
Now, you had indicated in the sedation video that we watched that documented the safeguards that are necessary, that a doctor in that situation would immediately assess the patient and then call for help. In a hospital, obviously, it wouldn't be 911. But in the home setting, then, would Dr. Murray be expected to immediately assess the situation and then call 911?
That is correct.
And the assessment would include what?
The assessment would include checking the pulse. Is the patient breathing? Is there a strong pulse? And looking for signs of responsiveness. You literally shake the patient and you say, we have a disaster on your hands. It takes a matter of seconds to make the assessment. And then 911 is called, and there has to be a way of calling 911. You're giving propofol in somebody's bedroom. The need to possibly call 911 is quite obvious. So it is irrelevant. If there are impediments to calling 911, the propofol should not have been given. 911 should have been called. It should have been called instantly, and access to a phone that can call 911 instantly was an essential requirement if one is to embark on giving drugs in someone's bedroom.
Dr. Shafer, I want you to assume that Conrad Murray became aware of Michael's condition sometime around noon.
Yes.
And that he then made a phone call at 12:12 and left a voicemail message for an individual, Michael Amir Williams, and then had 911 called at 12:20. So let's assume that 20-minute delay in calling 911, and also assume that in the middle of that at 12:12, Conrad Murray actually called someone else, left a message, and made no indication that 911 was required. How would you assess those specific facts as it related to the care or lack thereof provided by Conrad Murray?
That is so egregious that I actually find it difficult to even comprehend. That you could have a patient who has arrested, and you call and you leave a voice message for someone? It's just inconceivable to me that is how a physician would not do that. A physician would not call when a patient has arrested and leave a voicemail for somebody. I almost don't know what to say. That is so completely and utterly inexcusable.
Let me ask you this. Let's assume that Michael Jackson was alive, and as Conrad Murray told the police, he then left for just 2 minutes, and came back, and let's assume, based on Dr. Murray's words, that when he came back, having only been gone for 2 minutes, he promptly called 911. Would Michael Jackson be alive today, in your opinion? Or would he have a better chance of being alive today?
I believe he would be alive, but with neurological injury.
And why would he have neurological injury?
He still would have a period, his brain would still have had a period without oxygen of 8 minutes or so, something like this, given what I understand about the arrival times. And that period without oxygen would be enough to cause brain injury. So I believe he would have survived, but with a bad neurological outcome.
And again, because of the setting and not having the equipment there would be the supplemental delay of the paramedics actually arriving on scene with the necessary equipment.
Yes.
In the same scenario, and let's assume again that Michael Jackson's laying there alive, Conrad Murray leaves for just 2 minutes, as he told the police, and comes back, notices Michael's condition, but has the ability to ventilate and has the ability to treat the patient as a competent doctor would Michael Jackson still be alive?
Michael Jackson would be alive and uninjured.
I want to talk about the chest compressions. You've reviewed Dr. Murray's statement to the police in which he described doing one-handed compressions on the bed.
Yes.
Okay. Now, how effective, in your opinion, is a one-handed compression to a patient on a bed?
Not at all effective.
And why is that?
The problem with performing CPR, chest compressions, on a bed is that when you push on the chest, the patient just sinks into the cushion. You have to actually compress the thorax. You have to actually move the sternum against the spine in the back to squeeze the heart and also to move the blood in and out of the thorax, which is part of cardiopulmonary resuscitation. Just pushing the patient in and out of the bed is not effective. To push correctly, you have to be positioned. The force has to come directly down. If you're trying this with your hand, not only do you have a very poor mechanical advantage, but it's very hard to push straight down with a one-handed compression. It's always two hands pushing straight down with the patient on a firm surface. So you're not just pushing the patient in and out of the bed, which does nothing useful.
Now, what if Dr. Murray had a single hand under Michael's back and then was compressing with a single hand?
You just can't muster the force that way. You need your body weight behind this. You can't squeeze this. There's no power in that kind of positioning to squeeze something. You need your body. I've, in the course of years of training, done a lot of CPR and been involved in a lot of resuscitation, particularly as what's called a house officer in the early days of my training. And you throw your body into it because that's what it takes to move the breastbone, the sternum, enough to effectively pump blood for the patient.
What should Conrad Murray have done in that situation?
After calling for help,
911.
after calling 911, you would move the patient to the floor so that you're doing the CPR, the chest compressions, on the floor, and that way the force is effective, and that way you can also position yourself. Essentially, you straddle the patient with your legs, or you could be on the side, either way. But the point is, your arms are straight, you're moving your whole upper body to do CPR next to the patient on the floor. That's effective cardiopulmonary resuscitation. That's effective chest compressions, is what I should have said.
Now, you noted in your report that this was a serious violation, and you note that Michael Jackson's problem was that he wasn't getting oxygen. Can you explain that, please?
Yes. The issue here is not that Michael Jackson's heart has stopped. It's that the oxygen has run out of his lungs. He has stopped breathing. And because he has stopped breathing, his lungs have run out of oxygen. And his heart is only stopping because the heart has been starved of oxygen. What needs to happen, particularly when there was a pulse, as described, what needs to happen is you need to get oxygen into the lungs. That's why Michael Jackson is dying. He's running out of oxygen. And the resuscitation has to focus on getting oxygen into the lungs. In the presence of a pulse, the heart doesn't need to be compressed. The heart's beating. It doesn't need compression. What you need to do is you have to get oxygen into the lungs. If you get oxygen into the lungs, the heart will not die. But that needed to be the focus, not chest compressions.
And you're basing that on Conrad Murray's own words that when he returned after 2 minutes, he felt a thready pulse?
Correct.
Now, you also noted that the mouth-to-mouth resuscitation, as described by Conrad Murray, was also a separate and distinct serious violation. Can you describe that, please?
Yes. Mouth-to-mouth resuscitation for a member of the lay public who finds a person on the ground unresponsive is all you have available to move air in and out of the lungs. In that setting, there's no alternative. But for a healthcare provider to resort to mouth-to-mouth resuscitation is an admission of failure to have proper resuscitation equipment available. I've only done mouth-to-mouth resuscitation once in my life, and that was in a hospital when I was the first responder to a patient who had arrested, and I did mouth-to-mouth for about 60 seconds until the rest of the team arrived with the proper mask and bag. Because for a healthcare provider, mouth-to-mouth resuscitation is a demonstration, an admission that you don't have the equipment you need to properly move oxygen in and out of the patient's lungs.
And for a doctor then, because you differentiated between a layperson and a doctor, for a doctor in this situation that took place in this case, then the bag mask ventilation would be the standard of care?
Yes.
And because that's essentially more efficient at moving air into the patient?
That is absolutely correct. It's much more efficient. When you breathe into a patient's lungs, that's your expired air. The oxygen level in room air is 21%. I believe that the oxygen level coming out of your own breath is just 18%. You've lost a lot of the oxygen already that you're putting into the person's lungs. They need more oxygen. They don't need 18% oxygen that you have expired.
And that was a serious violation?
Yes.
Now, assuming what Conrad Murray said is true, that he was gone for 2 minutes and came back and felt a thready pulse, those are his words, could proper care at that time have saved Michael Jackson's life in that scenario?
Absolutely.
And again, that goes to the need to ventilate the lungs.
With oxygen.
Now, do you recall in Conrad Murray's statement where he describes raising Mr. Jackson's legs?
Yes.
And I believe you characterize that as a minor violation?
Yes, it was just a waste of time. I don't know why he did it.
And that's what I want to ask you about, because you did note it in your report. Why do you characterize that as a waste of time that Conrad Murray raised Michael's legs?
You would raise a person's legs if you believed that they needed more blood going to the heart. So if a person has had some sort of traumatic injury or a gunshot wound or something like this, it's certainly a very reasonable thing to do. But that's not the case here. There's not a problem with too little blood in Michael Jackson. So you would raise the legs to transfuse more blood to the heart. That's not the problem. The problem is he needs oxygen in his lungs. And even thinking about raising the legs, to me, just suggested that Dr. Murray was quite clueless as to what to do. It doesn't make any sense. It's not treating anything that needs to be treated in this setting.
For what is flumazenil used?
Flumazenil is a drug that can reverse or antagonize the effects of any of the Valium type of drugs. That would include lorazepam, that would include midazolam. And intravenous flumazenil is essentially an antidote that can quickly reverse an overdose of those drugs.
And in this scenario, where Conrad Murray admits to giving, over the course of time, in his words, 4 milligrams of flumazenil, was it 4 milligrams of lorazepam? Was it appropriate then to give him flumazenil, and did you draw any conclusions from that?
There was nothing wrong with giving flumazenil. It might have been useful, but 4 milligrams of lorazepam given hours before would probably not require reversal. So I thought it curious, given the description of only giving 2 doses of lorazepam, each quite small, that he would choose at this critical moment in Michael Jackson's life to give a drug to reverse lorazepam. It doesn't fit.
Does it indicate to you in your review of the records that Conrad Murray was aware he'd in fact given more than 4 milligrams of lorazepam?
That was my interpretation. That he knew he'd given a lot of lorazepam, which is why he very quickly reached for the antidote to lorazepam. He knew that Michael Jackson had had a lot. That was my conclusion.
Dr. Shafer, you speak about then the failure of Conrad Murray and the deception of Conrad Murray in that he did not reveal to the paramedics that he had administered propofol. And additionally, he did not reveal to the UCLA emergency room team that he had administered propofol. Did you find that to be a deviation from the standard of care? And if so, how would you describe it?
That is a egregious deviation from the standard of care. When a person's life hangs in the balance, as it did, to withhold information is inexcusable. And he withheld the information about the propofol. He also mischaracterized this as a witnessed arrest, which is very different from what it was. A witnessed arrest is usually not an arrest for lack of breathing. A witnessed arrest is usually something like a heart attack. You see the person and suddenly they're down and something catastrophic has happened. Particularly when a physician has witnessed an arrest. You assume it's some sort of cardiac disaster. Because in the presence of a physician, a patient should not be allowed to not breathe. when a physician is present. So a respiratory arrest, the cessation of breathing, that is assumed to not have occurred in a witnessed arrest when a physician is present. So the therapy that was directed towards Michael Jackson was therapy towards a cardiac event that was unclear. And the fact that this was a respiratory arrest and that it was caused by sedatives, and specifically by propofol, was withheld. So that neither the paramedics nor the physicians at UCLA knew what they were treating. A patient comes in an arrest. You have only seconds to go down a treatment path one way or the other. They were not given the information to choose a treatment path appropriate for what had happened. That information was withheld.
And from a medical standpoint, because the assumption based on Conrad Murray's statements would be that it was an almost instantaneous, you're observing the person goes down as a result of a cardiac arrest.
Correct.
And if your assumption is that the person went down immediately as a result of a cardiac arrest, that dictates what subsequent treatment may be.
That is correct.
What is a doctor's obligation in a type of scenario where the doctor's present when the injury befalls the patient and then the patient's care is transferred to another doctor? What is the doctor's professional, ethical, and moral obligation in that scenario?
To tell the truth. I can't put it simpler than that. The doctor is obliged to tell the truth, the whole truth, and nothing but the truth. The doctor has to say, this is what happened, and this is everything I know that may help you to save this patient's life. Anything less than the truth, the whole truth, is inexcusable.
And is this also then both an egregious and ethically unconscionable violation of the standard of care?
Absolutely. Again, the doctor-patient relationship is built on trust. It's built on the patient's interest always being ahead of the doctor's interests. When information is withheld, you violate that trust. When information is withheld from the people trying to save the life of your patient, you have violated that trust in ways that are so foreign to me, I truly have trouble even conceiving of it. Patients have a right to
Okay, the objection is sustained.
Okay, I'm sorry.
That's all right. Everything with patients thereafter is stricken. The first part of the answer is in evidence, ladies and gentlemen. Mr. Walden.
And in regard to what you're about to say, when a patient is in that situation and you expect a doctor to act in accordance with that bond of trust, what are the patient's rights in that situation?
The patient has the right to expect the doctor to be honest. Patients have a right to expect the doctors to be honest and place their interests, there being the patient's interests, ahead of the doctor's interests.
What is polypharmacy?
Polypharmacy is administering many drugs at once. Poly meaning many, and pharmacy referring again to drugs.
And in this case, from Conrad Murray's own words, you're aware that he administered diazepam or a Valium?
Yes.
As well as midazolam,
Yes.
lorazepam,
Yes.
and propofol?
Yes.
Is that polypharmacy?
Absolutely.
And how would you characterize that treatment?
I would characterize it as saying it doesn't make any sense. The reason I would characterize it that way is that lorazepam and midazolam are very similar drugs. And from the perspective of the brain, they're nearly identical. These molecules bind exactly the same, it's called a receptor, exactly the same thing in the brain. One just replaces the other, and do exactly the same thing in the brain. The only difference is how long they hang around for. That's part of the pharmacokinetics. How long they hang along. That's the only difference. I don't understand any rationale for switching between midazolam and lorazepam in a patient who you're having trouble having them fall asleep. Because they're binding the same place. The therapy that was used doesn't suggest any understanding of these drugs. Additionally, they're being given along with propofol. Now that's common. We commonly combine a drug like midazolam with propofol in anesthesia. But we do it in ways that we understand. We don't willy-nilly, let's give a little more lorazepam, let's give a little more midazolam, let's try some oral Valium, let's do this. The polypharmacy in this case suggests that it was done without any real understanding of the drugs that were being used, how they worked, and how they interacted.
And was that, in and of itself, another serious violation of the standard of care?
Yes, that was a serious violation.
Now, assuming, again, from Conrad Murray's own words, that the midazolam, lorazepam was given, and then just the 25 milligrams of propofol was given, would you consider that a safe dose of propofol in this setting as you've described?
Not at all.
Please elaborate.
In this setting, there are so many variables that make it impossible to predict the response to a dose of propofol that there is no safe dose. Midazolam's been given and lorazepam's been given. It would take me a couple days to try to figure out, with the models that I have, what the effect of that would be. It's not clear. I could calculate it, but it would take time. Then you have a patient who may be withdrawing from benzodiazepines, from Valium-like drugs. After all, this patient's been getting them every night for 80 days and may have withdrawal from them, or may have tolerance to them. We don't know. Could the patient have tolerance to propofol? It's not well documented because nobody does this. But we do know that to all the other drugs that act at that location, it's called the GABA receptor, all the other drugs that act there are associated with dependence and symptoms of withdrawal. So maybe the patient is dependent on it. Maybe the patient may have withdrawal from it. We are in pharmacological never-never land here, something that's only been done to Michael Jackson and to no one else in history, to the best of my knowledge. So any dose of propofol is a potentially dangerous dose.
Dr. Shafer, I want to question you about a experimental research paper from China regarding propofol in insomnia. And I want to get your perspective as an editor of an anesthesia journal. Do you know to which article I'm referring?
Yes, I have it with me.
And that is the article entitled Propofol-Induced Sleep Efficacy and Safety in Patients with Refractory Chronic Primary Insomnia, and published after Michael Jackson's death in November 25th, 2010, online?
Yes.
As an editor of one of the leading anesthesia journals, publications. Let me ask you, did you evaluate this research paper?
Yes.
Independent or as a result of your work on this case?
As a result of my work on this case.
And at the time that Conrad Murray was giving Michael Jackson propofol every night for a period of months, was there any literature that set the precedence that propofol was appropriate for the treatment of insomnia in this type of setting, or in any setting?
There was no such literature, and I can support that with numbers if you like.
You actually investigated and did research to see if there are any publications that have been subject to peer review?
Yes.
And you found none?
There are. The direct answer to your question is no, I found none.
What are the specific numbers that you found?
There are, this is actually just recent, but there are over 13,000 papers in the medical literature about propofol. There are over 2,500 papers in the medical literature about propofol sedation. This is found using something from the National Library of Medicine that every doctor and every researcher knows, called PubMed. 2,500 articles about propofol and sedation. If you ask for articles on propofol and insomnia, you get one article. That's it, just one article. And it's the article that I'm holding. There's only one paper, and it's this one, in the entire world's medical literature on propofol and insomnia.
And in your opinion, was the treatment, alleged treatment of insomnia by use of propofol, an independent, egregious violation of the standard of care?
Absolutely.
And as far as this actual publication, can you describe, are you familiar with the basic purported research or experiment that was put forth in that publication?
Yes, I've read this several times.
And where did that experiment take place?
The experiment took place in China at the 3rd Military Medical University in Zhangjiang, in the People's Republic of China.
And as an editor of the Anesthesia and Analgesia publication, did you review this article critically as you might any other submission for publication?
Yes, I did.
And what conclusions did you draw?
This is a paper that certainly we would not have accepted for publication, and in fact, I probably would not have even forwarded it to our editorial board for consideration, but would have rejected on submission. There are a number of red flags in the paper. The top of the list is it talks about the use of propofol for sedation, but it doesn't give the dose of propofol. It doesn't tell you how much propofol was used, which is a red flag that there's a problem. The next thing is that extraordinary claims require extraordinary proof. It's a fundamental concept when you look at the medical literature. The more extraordinary the claim, the more evidence you need to support that claim. This article claims that after 5 days of just getting a 2-hour infusion of propofol, 6 months later, the subjects who got propofol were still much improved in their sleep pattern. It could be true. It could be true, but it's an extraordinary claim which is supported by 64 patients. The evidence is not adequate for the claim. Lastly, the paper says something that I would never permit in anesthesia and analgesia. Based upon these 64 patients, this paper states, and I'll read it to you, propofol therapy is an efficacious and safe choice for restoring normal sleep in patients with refractory chronic primary insomnia. Efficacious and safe based on 64 patients. If you took this to the Food and Drug Administration and says, this shows safety and efficacy, you wouldn't get past the front door. This is absolutely inadequate evidence of that. And to make such a bold claim with such poor evidence suggests to me that the paper was not well edited. I will point out that this is published in a journal called Cell Biochem Biophys. I don't know this journal. This is the only paper on propofol they have ever published, and this is the only paper on insomnia that this journal has ever published. So it suggests to me that the editors of this journal were neither familiar with propofol nor insomnia as this paper went through the peer review process. So I do not find the conclusions of the paper convincing. And in my view, when authors overstate their conclusions to say, we have demonstrated safety and efficacy on a small pilot study, that's simply a grandiose claim that should not appear in the medical literature.
And in fairness to the authors, even they note in the article that future experiments and studies are necessary before conclusions could be drawn. Is that accurate?
Right, but that statement's been moved to the back. It's the statement on the front that concerned me.
And just to differentiate then from what the authors of this publication do reveal, to differentiate what they reveal compared to the standard of care exhibited by Dr. Murray, let me ask you a few questions. Do the authors of this study indicate that it went through some type of review process or ethical review board before they conducted the study?
Yes. May I read?
And what type of review did it go through according to the authors?
The study protocol was reviewed and approved by the Hospital Ethics Committee, and each eligible participant gave his or her written informed consent.
And where did the experiment take place?
This experiment took place at a sleep disorder center in the Department of Neurology and Anesthesia at Doping Hospital.
And do the authors note that each patient or each subject of the study fasted as required by sedation of this nature?
Prior to treatment, each participant was fasted for 8 hours.
How about the monitoring of blood pressure?
The blood pressure, electrocardiogram, and pulse oxygen saturation of each patient were constantly monitored during treatment.
And how about the use of an infusion pump, as you previously testified to?
In the propofol-treated group, propofol was infused intravenously for 2 hours using a micro-injection pump.
And that is an infusion pump?
That is an infusion pump.
And you used the word experiment. Was this essentially a research paper experiment requiring future work?
Yes, it's certainly a reasonable question to ask. I'm not critical of asking the question, although it's not a very good paper, but it's a reasonable question to ask. But it does not establish that this is a safe therapy by any stretch of the imagination.
Additionally, it post-dated Michael's death.
Yes.
Michael Jackson.
Yes.
Be asked, please.
It post-dated Michael Jackson's death.
Yes.
And how about polypharmacy, as you've testified to? Was there an indication of polypharmacy in this research, or was it just propofol by itself?
They were very clear that there was only propofol in the study.
Now, how would you contrast what was done in that experiment that post-dated Michael Jackson's death with what took place by Conrad Murray administering propofol to Michael Jackson in his bedroom?
The patients in this study were treated with the standard of care. And although I have concerns about whether or not it's a good paper, I have no concerns about the standard of care that was applied to these patients. What is described is entirely appropriate. And the paper, if anything, serves to highlight the many shortcomings in the standard of care that Conrad Murray used when attempting to use propofol to treat insomnia in Michael Jackson.
Did this publication in any way set a standard of care, even as we sit here today, did this publication in any way set up an appropriate standard of care as to the use of propofol for a sleep disorder?
No.
Dr. Shafer, you've very clearly described 17 separate, distinct, egregious violations of the standard of care, further noting that 4 of those were not only egregious but fundamentally unethical and unconscionable. Is that accurate?
I'm trusting you on the math here. I haven't kept track, but that sounds right to me.
Do you want to check?
I don't have I haven't.
Well, let's assume that's the egregious violations of the standard of care. The lack of the basic emergency airway equipment.
Yes.
The lack of the more advanced emergency airway equipment.
Yes.
The lack of suction apparatus.
Yes.
The lack of an infusion pump.
Yes.
The lack of pulse oximetry.
Yes.
The lack of and failure to use the blood pressure cuff.
Yes.
The lack of electrocardiogram.
Yes.
The lack of capnography.
Yes.
The failure to maintain a doctor-patient relationship.
Yes.
The failure to continuously monitor the mental status of the patient.
Yes.
The failure to continuously monitor the breathing of the patient.
Yes.
The failure to continuously monitor and have available the blood pressure, pulse oximetry, and heart monitors to maintain constant vigilant monitoring.
Yes.
The failure to call 911 immediately.
Yes.
The failure to chart and document at the outset of the procedure.
Yes.
That is both egregious and unconscionable.
Yes.
The failure to maintain written informed consent, again, both egregious and unconscionable.
Yes.
The failure to document throughout the course of sedation, again, egregious and unconscionable.
Yes.
And the failure to disclose to both the paramedics in UCLA the use of propofol and the facts surrounding what Dr. Murray claimed to be a witnessed arrest.
Yes.
And when I total those up, I come up with 17 egregious violations, 4 of which are also unethical and unconscionable. Is that accurate?
Correct.
Is that accurate?
Yes.
Now, you described at the outset of your testimony that your use of the term egregious equates to that individual deviation from the standard of care being expected and or likely to result in a catastrophic outcome, namely injury or death to the patient, Michael Jackson, correct?
Yes.
Would you agree that each one of these 17 individual violations individually were likely and should have been expected to result in injury or death to Michael Jackson?
Yes.
And in your mind, was that completely foreseeable risk?
Yes.
I want you to assume the same facts that you've analyzed from the evidence. Let's assume Conrad Murray gave this polypharmacy of drugs to a dehydrated, exhausted patient who may or may not have fasted. And let's assume Conrad Murray gave 25 milligrams of propofol and walked out of the room. And let's just assume for the sake of the hypothetical that Michael Jackson was then either ingested lorazepam and or ingested propofol. Would it still be your opinion that Conrad Murray is directly responsible for the death of Michael Jackson based on his at least 17 egregious failures in the standard of care and his abandonment of Michael Jackson?
Absolutely.
And would those risks that a patient could consume propofol and or lorazepam when abandoned, would those risks be, in your opinion, foreseeable, requiring the doctor to not abandon such a patient?
Yes.
Dr. Shafer, you spoke about the fundamental importance and the trust inherent in a doctor-patient relationship. And I want to ask you, as it relates to the standard of care in this case and the summary of the violations of the standard of care that you provided us, if you could put this into perspective as to what it is that Conrad Murray did to Michael Jackson and how it fundamentally violated the doctor-patient relationship.
I'd be happy to. The doctor-patient relationship, I believe, goes back to the dawn of civilization. I was in Egypt a year and a half ago, and on stones dating back thousands of years, you can actually see carved medical instruments that are recognizable today. So this relationship is a hallowed relationship. Doctors are permitted to know the most private details of a person's body. Doctors are permitted to know the most private and personal details of a person's life. Doctors are permitted to give very powerful drugs that might harm a patient or might kill a patient. Doctors are permitted to use knives and cut into a patient's body to remove a cancer or to repair an organ or to replace a knee. Doctors are allowed to do these things because of a hallowed relationship between the doctor and the patient. And if I may, I'd like to just give 3 observations of this. Doctors are associated with something called the Hippocratic Oath, dating back to 500 years BC. And to quote from it, "In every house where I come, I will enter only for the good of my patients." Because at the core of the doctor-patient relationship is that you put the patient first. That is the cornerstone of this hallowed relationship. It is because you put the patient first that you are entrusted with surgery, with dangerous drugs, with intimate knowledge of the patient. Quoting from the Declaration of Geneva, a more modern document, "The health and life of my patient will be my first consideration." That is at the core of the doctor-patient relationship. And finally, I have to quote Columbia University Medical Center, 4 words, "We put patients first." When Dr. Murray agreed to treat insomnia with propofol, he put Dr. Murray first, not Michael Jackson. When he showed up every night with bottles of propofol and bags of saline, he was not putting Michael Jackson first. He was putting Dr. Murray first. And in the emergency room at UCLA Medical Center, when he misrepresented the type of arrest that it had been and withheld information about the drugs that had been given, he was not putting the patient first. He was putting Conrad Murray first. This is the fundamental violation. The patient comes first. That did not happen here.
Mr. Walgan, at a
I'm
convenient
sorry.
time, let us know for purposes of the adjournment.
Did Conrad Murray continuously and repeatedly violate these fundamental tenets of the doctor-patient relationship?
Yes. Every night, these tenets were violated.
Thank you, Your Honor. That was a good time.
Walgan, thank you. May I see counsel, please? Ladies and gentlemen, at this time we will be taking the evening recess and adjournment. And I know it's been 6 days since I provided you with this formal admonition, and you haven't forgotten it, nor will you ever forget it. But please bear in mind and follow unhesitatingly this admonishment. Do not discuss this case among yourselves or with anyone else, or form or express any opinions about the case until it's submitted finally to you. Do not visit any scene or location that may have been referenced, mentioned, or involved in this case. Don't perform any experiments or conduct on your own or through another person any independent research or investigation on any topics, subjects, or persons mentioned or involved in this case. Do not come into contact with any television or radio programs, newspaper or magazine articles, books, or the Internet regarding any of these topics, subjects, or persons. Do not access on your own or through another person any research materials, including but not limited to any Internet website, including but not limited to any search engine sites such as Google, Ask, or Bing, or social network sites, including but not limited to MySpace or Facebook, or text or tweet, or access any messages, or post or access any blogs regarding any topics, subjects, or persons mentioned or involved in the case. Please have no contact or communication with the defendant, the attorneys, the witnesses, or spectators. If anyone approaches you or tries to contact you with regard to this case, or tries to provide you with access information so that at a later point in time you can contact a person or an organization regarding anything about this case, don't go there, and immediately notify the court staff. I think that about does it. Do all of you understand, and as you always have been, promise to follow these admonishments? All indicating the affirmative. Have a good evening. We're going to ask that you join us tomorrow so that all of us will be ready to begin tomorrow at 8:45 and not at 10 o'clock. Again, I apologize for the delays, and I see you're smiling. I hope you keep smiling. Please go to the jury room for just a moment, and we'll make sure that we can expedite your departure here, and we'll be ready for you at 8:45 tomorrow. And again, thanks for your patience. Good evening.